The mission and vision of Chrissie Tomlinson is excellent healthcare. We take pleasure in treating everyone that comes through the doors of the Chrissie Tomlinson Hospital, and we see them as preferred guests.
Patient-centered healthcare means everything to me. A hospital should be a great clinical environment that provides 5-star hospitality services. It's high-tech, high-touch. That means that we provide the best equipment possible in the interest of the patient, and we provide the best customer service possible in the interest of the patient. The best customer service means that from the time the patient enters the hospital, our hands are on them until the time they leave, and that they always feel supported by the staff of this environment.
Patients come first. I coordinate the pharmacy team so that the patients are well taken care of and get great medical information on their medications.
Well, it's what we stand for, and that's what we believe in, and that's what we try to give, patient-centered care.
Patient-centered care is where the patient comes first in all aspects. Physical, psychological, emotional, everything about a patient. You've got to be your patient's advocate.
Patient-centered healthcare is getting the patients involved in their scope of care, letting them tell you their ideas on how best they think they can obtain their well-being. You involve, along with the patients, their families. Everybody comes together in a collaborative agreement on the patient's care.
The patient needs skillful attention. The patient is the most important part of the healthcare. It's not the paperwork, it's not everything else, it is the actual patient. As a registered nurse, we're the front line. We deal with the patient before the doctor deals with the patient. We find out what the patient's problems are and we try to help them as best we can before the doctor gets there.
Putting the patient first and trying to meet all their needs in a friendly way.
It's about compassion and about taking good care of patients. They're treated like family. That's all about Chrissie Tomlinson, about family.
The patient, the family members, and the doctors all collaborate as a team for the benefit of the patient to promote health and continued success.
You have to put yourself in their space, to know what they're feeling and be compassionate.
Being honest, respectful, and sweet with the patient.
I personally think it should be personalized and considerate for all their needs, financial or otherwise. I mean, what I basically do is call my patients and try to work with their budget.
It's good to manage financing so we can reinvest in quality products that allows us to take care of our patients.
It begins the moment the patient walks through the door of Chrissie Tomlinson Memorial Hospital. And it begins from the time we register that patient, making sure that we make them comfortable, find out what their needs are, to the point that we get them to the doctor, making sure that we have all their demographic information correctly, making sure we know what allergies they have so that it's clearly labeled on their files. And from that moment on, they see the nurse who will take their vitals, and then we move them on to the doctor who will diagnose and treat and make sure that from the moment they step through our doors to the moment they leave, that they have been given the best care possible.
Everything you'll do will be focused on the patient and providing quality for that patient.
Basically focusing on the patient's well-being. The physical therapist function is the most important in terms of quality of life.
Patient-centered healthcare means that you're ensuring that the patient is well taken care of and ensure that the patient is managed as a patient, as an individual, and not necessarily treating a condition.
Means compassionate quality healthcare, keeping in mind at all times patient safety and customer satisfaction.
Each person coming to see me with a problem that needs help is very much an individual. It is not that they're part of a broadly based wide process, they're not part of a crowd, and they're coming to see me, and I should feel flattered and privileged that they've come to see me. Patient-centered is all about that unique and single relationship between doctor and one patient.
Respect for patients' confidentiality. Treat them as they're one of your own, as a family member. Offer them the best service possible, efficiency, as well as effective transition from check-in procedure to patient care with regards to nursing and doctor, and make them feel comfortable in the environment they're in so that we can provide better service, quality service, efficient service.
A simple word is putting the patient first. Making sure that you take consideration for what the patient is presenting for and do what's in their best interest. Making sure that you look at the whole patient, try to figure out what's going on with them, why are they here, and what needs to be done to help them in their situation.
There is no other way than patient-centered healthcare because that is what we do.